Board. My name is Hilary and I'm going to be doing your physical assessment today. If that's okay with you, I'm going to wash my hands to get started. Okay, would you mind verifying your full name and your birth date for me?
Summer Ward, 12/15/77.
Thank you. Okay, I'm going to start your physical assessment by looking at your head and your scalp and your face. I'm going to be inspecting and palpating. I'm looking for any lesions or abnormalities. It looks symmetrical. I don't see anything abnormal. Your face is symmetrical. Your eyebrows are symmetrical. Next, I'm going to be palpating your sinuses. Let me know if you feel any tenderness or pain. This is your maxillary, your frontal. Okay, next I'm going to be moving on to your ears. I'm going to be inspecting and palpating. Let me know if you feel any tenderness. The color is consistent with the rest of your body. Okay, I'm going to get my pen. I'm going to look inside. There's no drainage. Okay, next I'm going to be moving on to your eyes. I'm looking at your pupils. They're round. They're the same size. Okay, I'm going to shine a light and see if they constrict the reactive. So just look ahead. Thank you. Good. They're reactive to light. Next, can you follow my pen for me? Good. And then to check for accommodation, I'm going to have you look at my pen, look at the wall on the back of my pen, if you can do that. Thank you. They are accommodating. Okay, I'm going to move to your nose now. I'm inspecting and then I'm going to palpate. The color is consistent with the rest of your body, so is the temperature, and I don't feel any bumps or abnormalities. I'm going to now look inside. Okay, it's pink and moist, and no deviated septum. Okay, now I'm going to check for patency. I'm going to cover one side and have you sniff on the other. Okay, now I'm going to do that again. That's good, no obstructions. Now I'm going to move on to your mouth. Looking at your lips, they look hydrated. I don't see any cracks or lesions. If you'll open your mouth for me, I'm going to look inside. I'm looking at your teeth. They're white. Your gums are not receding or bleeding. Your tongue, can you put it down for me? There's no white patches. It's pink and moist. Your tonsils are present. No white patches. Your hard palate and your soft palate are pink and moist. Can you lift your tongue out? Pink and moist. No sores. Okay, before I move on, I'm going to check your hearing acuity. If you'll cover one ear, I'll whisper something into the other one, and then if you'll repeat it back to me.
3, 4.
Okay, I'll try to do the other one.
6, 7.
Thank you. And before I go on, I'm gonna look at your conjunctiva, pink and moist, and your sclera. Okay, that's white and moist. Okay, so your neck, that's what I'm gonna be looking at next. I'm inspecting. I don't see any bulges. It looks symmetrical. Now I'm gonna palpate. Symmetrical. I'm going to palpate your thyroid gland. There's no bulges or abnormalities. Okay, next I'm going to palpate for your carotid artery on each side, one at a time. It's regular. Next I'm going to be listening, and I'm going to be listening for a brewery. And if I did hear this, this would mean there could be a narrowing or obstruction. So I'm going to listen to that. Your pulse is regular, and I did not hear an indication of a bruising. Alright, I'm going to be moving on to your anterior thorax. First, can I have you breathe deeply in and exhale? Okay, you're not using any accessory muscles, and your chest is rising and falling symmetrically. I'm going to inspect and palpate. Okay. Your skin is consistent with the rest of your body, so is your temperature. I don't feel any lesions or see anything abnormal. Okay, I'm going to be listening to your lungs next. Just breathe normally. Okay, your breathing was clear. I didn't hear any crackles, wheezing, or bronchi. Okay, next I'm going to be listening to your heart sounds. Okay, so your heart is located on the left of your midclavicular line, between your fourth and your fifth intercostal space, right there. Okay, and I'm going to be listening to your aortic valve, which is to the right of your sternum, second intercostal space. Then I'm going to move to the left of your sternum, which is the pulmonic artery, valve, which is on the second intercostal space. Then I'm moving to the third on the left of the sternum, which is the Erb's point, the fourth intercostal space, left of the sternum, which is your tricuspid valve, and the fifth intercostal space, which is left of the sternum, which is where your mitral valve is. And I'm also going to be listening to your PMI, which is around right here, which is also your apical pulse. Okay, your pulse is regular. I didn't hear any murmurs. Okay, I'm going to go ahead and I'm going to talk to you about monthly breast exams. Are you doing those currently, or?
Well, sometimes.
A little bit. It's always a good time to start doing that or thinking about it. I'm going to show you a way I do it. You can do it in the shower or when you're lying down. It's best, but you put one arm behind your head, and the other one you put kind of in your armpit, your axillary area, and you're going to palpate with 2 or 3 fingers around here. You're going to feel for any lumps or masses or any pain. You're going to start going around, all the way around here, and the outside of your nipple, and work your way into the inside of the nipple. And then when you get to the nipple, you're actually going to squeeze. So you're going to want to do that on both sides. And you're looking for any pain, discoloration, or discharge. And if any of that happens, you'll want to contact your healthcare provider. And you want to try to do that about the same time every month. Okay. So I'm going to go ahead and do your upper extremities. And so I'm going to palpate and inspect. Okay, so your skin, the color is consistent with the rest of your body. So is your temperature. I don't see any erythema or redness or edema. Okay, I'm going to check your capillary refill. That's less than 3 seconds. I'm going to check the turgor, which is elastic. I'm going to check your brachial pulse, your radial pulse. Those are bilaterally symmetrical and regular. Okay, I'm also going to test your neurological reflexability. So this side is dull, this side is sharp. So I'll have you close your eyes and then tell me which is which.
Dull. Sorry.
It's okay.
Sharp. Sharp.
There you go. Thank you. Okay, next I'm going to have you stand up and turn around for me. Okay, so I'm going to check your spine first. Okay, the curvature is good. There's no scoliosis. I'm going to be inspecting and palpating. Okay, on inspection, your skin is consistent with the rest of your color of your body. The temperature is also, there's no excessive moisture. Okay, I'll have you breathe in deep for me. And out. Okay, your breathing is symmetrical. I don't see any abnormalities. Okay, if you'll go ahead and step back down for me. And next I'm gonna have you lay down, and I'm gonna do your lower extremities. Okay, so first I'm gonna inspect and palpate. The coloration is consistent with the rest of your body. There's no bumps, there's no lesions. Okay, I'm going to check your femoral pulse. It's bilaterally symmetrical. Your popliteal, it's also bilaterally symmetrical. Your dorsal pedis, same. And your posterior tibial artery, bilaterally symmetrical. I'm going to check your circulatory refill. Both are less than 3 seconds. I'm going to do your neurological reflexes. So same. I'm also going to do your range of motion. So going up would be flexion, going down is extension, okay, going out is abduction, and in is adduction. Do the same on the other side, flexion, extension, abduction, adduction. That's all good. Now I'm going to move on to your abdomen. So first I'm inspecting, and I see it's flat. I don't see any masses. The color looks consistent with the rest of your body. I'm going to listen before I palpate, and I'm going to go in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. What I'm listening for, or oscillating for, is vowel sounds. I don't want them to be hyperactive, hypoactive, or abnormal. I'm going to do that now. Okay, there were vowel sounds in each quadrant. If there weren't, I would listen up to 5 minutes in each quadrant and make sure that there were. I'm now going to palpate. Let me know if there's any tenderness. I don't feel any lumps, masses, or obstructions. The temperature is of your skin is consistent with the rest of your body. I can go ahead and help you up. And before we end today, let's go ahead and do the range of motion for your upper extremities as well.
Okay.
Okay. So if you'll just follow me, flexion, extension, abduction, adduction, and okay. Go ahead and push down, push up, push down, push up. All right, that's it. Thank you so much for allowing me to do that. Do you need any help getting